Better turn off my video.
Good afternoon.
Good afternoon.
Guys look great.
I thought we were set up perfect.
Do we need to?
Can we tilt the profiles? And thank you so much for joining us today and giving us this opportunity. I'm going to begin sharing my screen with everyone. And I'm just going to get right into it. So here I am logged into a demo database for the addiction treatment profile. This should look familiar to everyone. And what we're going to do is briefly go to a test client and open the Med Clinical. The profile set of documentation for the assessments begins with a pre-screen, the CDA, which is also biopsychosocial, a psychiatric assessment, a history and physical exam, a nursing assessment, a master treatment plan, a discharge and a discharge summary. The pre-screen is where the flow of data begins with the profile. It is an optional element to use in your practice, and our current clients are using it in one of three ways typically. This pre-screen is available via the client portal as a remote application that a client can complete via a link on your website or a tablet that you have in your lobby that you can hand to the client instead of a clipboard. It is also a document that your staff could complete during a phone screening with a new potential client. And I want to begin giving you a tour of the information that is contained within that pre-screen. So the client's name, of course, and basic demographics, insurance information, if that is applicable, the client's presenting condition or the reason they're seeking treatment, medical history, including whether they have a primary care provider, and if a physical exam has occurred within the last 12 months. Current medications, and I'm sure all of you will notice that this includes over-the-counter medications, vitamins, herbs, and any past medications for mental health or substance use treatment. This also includes a query as to whether the client is taking that medication as directed and whether they believe that that's an effective medication for them. It includes allergies, and there are options for a drug type, food type, or environmental allergy. A standardized medical condition section that includes seizures, head trauma, ADLs, communicable diseases. You can see here if pregnancy is indicated, are they receiving prenatal care, and who is that provider? This also includes acute chronic pain with a follow-up pain scale and a place for details regarding that pain. It is collecting medical surgical treatment history, family medical history, It has a brief nutrition screen that is verbatim to the requirements of the Joint Commission. The behavioral health and substance use history section, which is going to begin with the client's drug choices 1 through 3. The major classifications of substances that are recognized within the United States here on the left, including a place to specify the type of substance that's being utilized. You'll notice that the substance table includes nicotine, over-the-counter medications, prescription drugs, and also a place for other. And this is best note standard, but this is an expandable table where if something, if you wanted to add something in by name that wasn't on the list, you could, and the table would continue to grow to accommodate those answers. Another feature of this table is the options on the use pattern. Those options are current and past, and none. This table also includes symptoms, withdrawals, cravings, and increased tolerance associated with that substance. This is a relatively new addition that came through this fall in accordance with the CARF standard. They are wanting, for each substance that the client is reporting, they want to find out what the client's pattern of use is, whether it's continuous, episodic, or binge, and also what the method of acquisition is for that substance. I believe that that standard was added to try to help identify any patterns of risk that are occurring for the client that could increase their recommended level of care. Family behavioral health and substance use history, mental health and substance use treatment history. You'll see that there are options here for the types of treatment that may have occurred for the client. Any additional narrative detail for that, whether the client is experiencing legal needs or that they have any immediate trauma, abuse, neglect, or exploitation that they would like to report. We did add this last field here on the application, asking the client if there are any other current stressors that are occurring for them. And what we have found is that up here at the very beginning of the interview, when you're talking about, well, why are you seeking treatment? That a lot of times the client will report something very abbreviated. And then down here at the end, if we follow up with, well, what are any of the other things that are exerting pressure in your life, that they're more forthcoming, and providers have so far reported they found this to be very helpful. So this pre-screen that I've shown you here is identical to the portal application. Sorry, one moment. That looks like this. And this is the application that I mentioned earlier that the client could access via a web link on your portal, or that you could have ready to go on a very inexpensive tablet in your lobby. And this is what it would look like for the client. Of course, this would be your own company's logo here. As you can see, it is very short, but there are some really amazing features regarding the portal. It is collecting demographic data about the client or the person who is going to be receiving services. It is also including the referral source, some key points of additional demographics that you see here, but it's also allowing the client to complete, to provide information on up to 4 additional related contacts. And that's what you can see here. And we've streamlined to this, the design of this recently. And there are some really nice features here that can make this quick for the client to fill out. But each one of these related contacts also has a place where they can define that relationship to that contact and then give you further information regarding that relationship. And then here you see the insurance information, and this is where you begin to see that perfect match between this portal application and what I just showed you on the pre-screen. So I'm going to just move over to page 2 and show you that information from the client's view via the portal. Okay, wonderful. And now what I'm going to show you, and this is where I think the portal becomes really amazing as a potential feature for use within your facility. I am in Best Notes now. I would have received an email at the facility saying that a new portal application had been submitted. That would cue me as staff to click this admissions button in Best Notes. And right here, it's going to show me that I received that application. I'm going to click view. Everything the client completed in that portal application will be showing here in red. But this is so quick and easy. I'm going to click add to Best Notes. And here I'm going to select create new client or new contact. And now I also get to bring in those related contacts as well. Okay, beautiful. Now I'm going to hit done. And then just to keep my inbox and my application manager clean, at this point, I'm also going to archive and lock that. Wonderful. And then if I ever needed to, I could look and see what I had done historically. Now, up here in the contact search bar in Best Notes, I'm going to type in that client's name right here. And so when I imported that application, the act of importing it created this client file for me. It brought in all of this data, including this data here. It brought in those related contacts and embedded them in the client's related contact tab here. And as you can see, it also brought in those special designations. Here is a copy on the activity log of the imported application. But this is where the profile and the intelligent movement of data really becomes amazing. If we now go to the MedClinical for a webinar test, and we go to the pre-screen, you will see that all the information that the client completed via the portal has imported for me into the MedClinical. We have mapped this data to move from that pre-screen forward into all the other documents within the profile. And so now we're going to get into the CDA. I'm going to widen this out just a little bit. This is just a preferential thing. You can, of course, take your assessment full screen like this, but my personal preference is to actually have it in this pop-up window. When you're here on the CDA, all of that information that populated in, your providers will have full control over it. Here they'll be able to amend it as the client is more forthcoming during that face-to-face encounter with the provider. The other thing that you're going to begin to see for the first time in the CDA is this red text. This red text is provider-facing prompts that are going to help your staff understand what the expectations and the requirements are regarding the content that they are documenting within the client's record. The red text that you see here does not print on the finalized snapshot that goes into the client's record. Okay, and then you're also going to begin to see additional content beyond the client self-reported data that was collected during the pre-screen. For example, whether there are any active withdrawal symptoms. We program this that if there are none that are reported or observed, that section will collapse. We've also indicated a place to say that we completed a COWS or a CEWA with the client, and a place to add any notation here. And then, of course, if any symptomologies were present, you can select those and then add any narrative detail to that that is appropriate. Okay, and then you're going to see an expansion of the substance use history section where we're querying about the client's relapse history, longest period of sobriety. And of course, this is Best Notes normal, but we have programmed elements within this to have dependency values. So for example, if the client says, yes, I have a history with IV drug use, there's a follow-up question, have you ever shared needles? And then a place to provide details about that. Now here within your medical history section, any medications that we'll display here actually need to be added into the medications tab. So your pre-screen, the client self-reported medications that they were taking right here, Med1, Reason, etc. But our system wants medications to be ratified by the facility, and that's a way for you to ensure that there wasn't an error in what the client self-reported, but also because you might make a decision or recommend that the client switches a medication. See, I'm doing Xanax. I'm going to say that this is for anxiety. We're going to say the prescriber was Dr. Pepper, who is a third-party doctor not at my facility. These are optional notes. I'm going to give the client a very low dose because I don't actually know what the right dosage for that medication would be. I'm going to say it is daily and that the prescription began for the client, let's say on January 4th. And I'm going to save that information. Now, you can have your intake staff actually gather that information from the pre-screen, validate it maybe for typos or dosage errors, and then have them enter in the medications and the client reported allergies before your provider has the CDA with the client, but that does vary from facility to facility. And then once that is recorded in the system, when you get to the medical history section within the CDA, I'm going to try to scroll down not too fast, you'll see that that information will then auto-populate in here. This also includes an area to indicate that you reviewed the client's past medications with them. If vitals are being recorded, those will show up here. Now, before COVID, the majority of the providers that we work with would not record vitals during the CDA, but I'm finding more and more facilities at a minimum will do a temperature check right when the client comes in, and I just clicked vitals right here, and I'm just going to record that temperature. And now I have record that I did that before having that meeting with the client. Sorry, I'm going to slow down on my scroll. Oh, sorry, I rolled right past it. And then you'll see that the vitals were entered by John Winther on this day and this time. And these are the totality of the vitals I recorded. Okay. And now we get into the emotional behavioral section in the CDA. And the first thing I would like to show you is that we designed this so that if there are any of these main categories of symptomology that are not being reported by the client or not being discussed, anxiety, for example, that if this box is unselected, what will save on the finalized document will be anxiety and none reported. But each one of these, if it is indicated and discussed with the client, you'll see, again, those provider-facing prompts here. And I'd like to bring special attention to the trauma, abuse, neglect, and exploitation section. I'm sure that you'll recognize that it is in accordance with the standards of Joint Commission and CARF, and that it includes whether the client was a victim, perpetrator, or witness of trauma. And there's also a prompt regarding duty to report. And then also some clinical guidance as well. This includes sleeping. This is another notable inclusion. Other addictive or compulsive behaviors that are non-substance use. For example, gambling, pornography, sex addiction. Okay, and then of course we could not include all of the possible symptomology that a client could be experiencing. So the end of this section, other emotional, cognitive, behavioral, or mental health conditions is a very important inclusion. And this is just a small formatting tip, but all of these boxes here have a standard starting size. But if I grab this little corner here with my mouse, do you see how I can expand that area for my own view and typing to record as much information as is relevant for that topic? Our next section is readiness to change. Relapse, continued use potential. The recovery and living environment. Okay. And this section actually includes treatment participation by family. Please don't judge my bad spelling. We have programmed this area, if it is recorded in here, to populate forward to your master treatment plan. This, of course, includes cultural considerations and the client's religious or spiritual orientation. And then, of course, if there's any imminent danger for them occurring. The next section is our standardized risk assessment section. And the purpose of this, very similar to the nutrition screening that happened in the medical history, is that this is an abbreviated screen of the client's risk. It is asking for all current and past instances, but it includes access to means, including weapons and firearms. Here, this would be where you would report any dangerousness, suicide, homicide, self-harm. But this section also includes any other life stressors or risk factors that are occurring for the client. And it also includes protective factors and natural supports, which is an element that Medicaid and Medicare really appreciate having being included in this risk section. My favorite thing about this section, however, is that if you say that a safety plan is needed, anything that is recorded here has been programmed to populate forward to the master treatment plan. I'm sorry, everyone, I'm a little bit nervous. This is our standard mental status exam. Okay, and then our next section is the SNAP. This has also been programmed to populate forward to the master treatment plan. And then this is a new section. It is our supplemental assessments, tools, and records section. And the intention here is that if there's any outside document, instrument, assessment, test that you are going to have the client complete that is going to affect the results of your clinical formulation, that document would be referenced here. For example, if I am working with this client webinar test and I'm completing the CDA, and based on the questions that we've already gone through so far, I'm thinking that the client is showing some indications of depression. I can choose to actually utilize an outcome tools instrument during my session with the client. And I'm going to demonstrate that for you right now. Okay. I'm sorry. Can everyone hear me okay? All right, thank you. So what I would do is I would take this pop-up window over here to the right, and I'm going to click on this Outcome Tools tab right here. I'm going to click Add Client. And what's going to happen is Outcome Tools is going to open up in a web browser window for me right here. I'm going to immediately click Questionnaires. I'm going to select which questionnaire I would like to complete with the client. And for this example, I'm going to choose the PHQ-9 to determine, to use an evidence-based instrument to find out where the client might be presenting in regards to depression. But another really good example is when I was completing that risk section. If the client had, let's say, a significant history of suicide within their family or even personally, at that moment in time, I would also complete a Columbia suicide with risk factors here. But for today's purposes, I'm going to select the PHQ-9 because this is happening at the time of assessment. I'm going to select A0 as the instance. A stands for admit, D stands for discharge. And, but I would also like to point out that if I were this client's primary clinician, that at the time of assessment, I would do a PHQ-9 to establish a baseline. But more than likely, as we continue to do individual therapy, I would continue to have the client complete that weekly. And when it comes time to do the weekly ones, up here in the instance, I would type in W1 for week 1, W2 for week 2. And I just wanted to show you that it has that capability right here. And so I'm going to go with the A0. And it's going to be completed by the client. You'll see that I have all of these delivery methods to available for the outcome tool instrument, including emailing the instrument to the client. But because I'm going to do this during my session with the client, I'm going to select in-person interview. And I'm going to click this lightning bolt. And then my selection is going to immediately show up right here under assigned. I'm going to click this icon right here, which is view questionnaire. And now you're going to see the actual PHQ-9. And I'm going to ask the client these questions. And I'm just going to randomly move through here kind of quickly, everyone. And then I'm going to click on submit. Okay, and then that instrument's going to show up under completed. It's going to show me the score as long as it's a scored instrument. Not all instruments have a scoring mechanism with them. I can view that completed questionnaire right here while I'm in Outcome Tools. And one of the nice things about the PHQ-9 and also the GAD-7 is they actually, once they're scored, provide this consideration up here at the top, and they do like that feature on those instruments. But where I think it becomes really amazing is, let's go back to Best Notes now. If I hit refresh here, I'm going to end up with this sidebar that's going to show me which instrument and the day that the client completed it, and also their score. So very easily at a glance, I'm going to be able to see how the client's scores are changing over time. Additionally, that completed instrument is now in the client's activity log and available to me for viewing or printing at any point in time, which becomes, I think, very relevant. Actually, I will pull up my Med Clinical now and back to the supplemental assessments, tools, and records where this began. So here's the provider. I would type in the PHQ-9. I would say that that happened. Oh, sorry, I did something strange with my keyboard, everyone. Okay, and then I can see right here the results, and their score was 20. And that's actually, I believe that's severe, but let me double check. Yes, severe. And then for implications for treatment, this is of course up to the discretion of your providers, but my go-to is monitor weekly. And then the next section is client education. And then this is another new feature within the profile that I hope that you all really enjoy. So we get to the clinical formulation and medical necessity. Your providers have two choices here. They can select to do their formulation according to a standard clinical format, which is more narrative based. If you are needing to create your formulation by dimension, you have that option here. And for each dimension, there's a place to indicate severity level, and then put forth basically a brief summary of the client's status within that dimension. And then at the end of that, it includes a place to indicate the recommended level of care. So let's pick intensive outpatient for the client. We have two options over here: eligible to transition into care or referral needed. So if you've done the CDA and the client really is more appropriate for a higher level of care than your facility provides, this would be a great place to indicate referral needed and actually send a copy of this snapshot to that new facility once the release of information was completed, of course. And then right here, this is where your provider will put forth the justification or the elements that help them come to the decision that they made for that recommended level of care. All of the assessments within the profile have this initial treatment plan section within them. And this allows your providers to immediately select a diagnostic category for the client. Yeah, that's fine. And then there's a place where your providers can actually free type additional criteria. But then down here, these gray buttons, as I'm sure you all know, this is the requirements. I'm sorry, the criteria from the DSM-5. And that should be pretty normal. Just going to scroll back down here, but I would also like to point out the reason at this moment in time that we have this initial problem / diagnosis is that this also supports a client stated goal. And I'd just like to quickly demonstrate that for you. Okay. And I'm going to just move back to that area quickly where we were. And then once those selections are made here, it's going to display for you down in this initial treatment plan section. Any initial goals that are added here has been programmed to auto-populate to the master treatment plan. There's a place to also include recommended services. If drug testing is recommended, their rationale is required, and that is in accordance with the standards of CARF. And there's also a place to record any referrals that you feel are needed or that you provided during that session with the client. And that is the CDA. And I am going to do this. And now normally I would add myself as the provider here as a required signer and then publish this snapshot. Okay, wonderful. I'm just going to touch on these other assessments very lightly, the psychiatric, the nursing, and the history and physical. The psychiatric is essentially exactly the same as the CDA with two notable exceptions. It includes a psychiatric review of systems section and a medical review of systems section. Here. And then the nursing assessment is very much like the CDA and the psychiatric, except for it does not include the psychiatric review of systems or the emotional behavioral that you found in the CDA. But of course, it does feature the same medical review of systems. And then I would like to move on now to the master treatment plan and just follow this model for today's presentation of following a client's continuum of care. So here within the master treatment plan, let's say this is going to be the initial master treatment plan for the client being in IOP. I'm going to record that. And I did forget one optional feature that I think is worth mentioning. So the episode tab within Best Notes is an optional feature. It is a really great way to track multiple programs or multiple levels of care that your facility might be providing. And if you choose to utilize that feature in Best Notes, we program that information to auto-populate in the master treatment plan, the discharge summary, and the progress notes. And I'll show you that in just a moment. So here, I had to say that I admitted the client, and now I can record a program or a level of care for that client. And I'm going to say that we brought them in to our IOP program at our location A building, and that I am going to be their primary therapist. And I'm going to hit save program data. Now, when I come to the master treatment plan, because I've elected to utilize this episode tracking, that you'll see right here, that information has auto-populated for me. And that can be really, really useful, I think. And the profile team does heavily recommend that you consider utilizing that feature if you're not already at your facility. As I mentioned earlier, the client's presenting condition has populated. The self-reported stressors or areas of difficulties, the client's SNAP, treatment participation by family, the initial goals, any safety plan data, the client's medications. And then here in this part's Best Notes normal, but once you pull in any preliminary diagnoses to the client's chart, it will take you through the wizard to add long-term goals, objectives, and your interventions. Okay, now this part should be very familiar to everyone now because this is Best Notes standard. But I would like to point out just a few highlights while we're here. The Profile Master Treatment Plan includes a discharge, transition, and aftercare planning section, which includes any additional criteria that need to be met, the client's discharge transition date, estimated, of course. And I'm just going to put in numbers right now because we have programmed this section to populate forward to the discharge summary. And I'm going to use these numbers just to show that that population occurred. Okay. And it does include an area for crisis information. And what we can do if you choose to opt into the profile is you can actually send us the block of phone numbers that would be appropriate for your area and your clients. Typically the local hospitals or there's always, I think, a suicide prevention hotline that typically gets included. And we would be able to add that as custom content into this section for your company so that it wouldn't have to be typed or copy and pasted all the time. And that's our master treatment plan. I'm going to make sure that I say the date that I completed that original document. I'm going to publish a snapshot here. And then I'm going to move on to our progress notes. Now here at a client's page, you can manually launch documentation by clicking the new note button here and selecting a template. And I just want to point out that all template documents that come from the profile, or I believe we've tried to identify all profile documentation with this asterisk in front of it. Included with the profile comes this set of template documents, which includes nursing progress note, case management, a CVRS progress note, the clinical peer support and recovery coaching, psychiatric progress note. And we have also included, in my opinion, a fairly generic utilization review document. It is likely that if you need to complete those, that this document will suit your needs, but it's also possible that we would want to customize or tailor one for your facility. But there is a starting one that comes with the profile. Now, as I began to say, you can manually launch any of these notes right here on the client's page by clicking this, and then the note will open up. However, I would like to highlight for you an additional piece of connectivity that we programmed with the profile and some of Best Notes standard features. And that's going to touch in on the calendar programming. And I tried to prepare these before the meeting today. And I just need to update the client to the new client we brought in via the portal. And in real life, you would not see these 3 appointments stacked up like this on the same day. I just wanted to acknowledge that as well. Okay, excellent. Okay, so utilizing the calendar in Best Notes again is optional, and we do want to make sure that using the calendar is something that is an efficiency increase for you and your facility and not an administrative burden, if you will. So that's one of the things that we can work with you and kind of discuss the pros and cons. There are Best Notes' calendar programming is actually very sophisticated, and I would like to show you some of those features. So utilizing that, we have pre-programmed different appointment types within Best Notes, and it allows us to specify what document we would like to be completed during that session or encounter. And if there is an applicable billing code and you want to run or track any electronic billing through Best Notes by setting up a ledger, we can associate also the ledger charge or the ledger code and units along with that appointment. And the benefit of that is that you, your admin, your billing staff can set that up ahead of time, and then your actual providers, all they need to do is process their appointment as they do their work or complete their documentation. So for example, I've set up, let me just show this one more time. This particular appointment is going to be the admissions packet, and this is going to be consents, rules and regulations, things that I need a new client to complete, typically at the same time or before they're going to receive services. That is not a billable event, so there's no code showing here. When I am ready as staff to process that very easily, I can right-click this dark bar and hit check-in. It's going to launch that document for me. It's going to automatically add me as the signer. And if there is a day and time of service that needs to be recorded within the document, that will auto-populate. And so this is just an example here of a multi-page admissions packet or new client packet that we would utilize in our facility. We do our best to design or program these admissions packets so that all staff needs to do is open it up, add the client as a required signer, and then hit save, sign, and lock. If we're not able to do that and the admissions packet does require staff input, we will typically add a pre-programmed multiple choice button right here so that they can open this up, hit their buttons in the order that need to be completed, add the client as a signer, and then hit save, sign, and lock. Okay. That document is now completed, but here you'll notice I have this new play symbol on my appointment. And that's a visual representation to myself that I have not completely finalized that document. Once I I'm going to right click this appointment again and check it out. Checking out an appointment is going to do two things. It's going to change this symbol so that I have visual identification for myself and also my clinical director that my documentation is complete. But it's also at that moment, if you're using our any of our billing features, that ledger data is going to be recorded for the client. And I'll visually show you that again in just a moment. So now, and I just wanted to show that our calendar appointment types will also launch med clinical documents now. And so I just wanted to show you that. Right here, it opened up the CDA for me. And I'm going to close that out because we already did it, and then check it out. And then here, this is what I really wanted to show you next was the clinical progress note. And the beautiful thing is this appointment, I've set it for today at 4 o'clock. And I'm going to process this appointment as the provider when I am ready to complete the documentation for that session. So depending on my style as a provider, that might be something that I would complete during my session, maybe 15 minutes immediately after my session happened, or what I found to be more common in the industry, maybe the next morning. But the good news is if you process from the appointment, like so, it's going to launch that note for me. It's going to auto-populate the correct day of service. It auto-populated my name and credentials. And then we're going to actually begin flowing through the profile standard clinical progress note. The first section is the session details. And here I'm going to record the stop time for my appointment. I'm going to say that this was an individual therapy section. Now, because I'm using the calendar appointment and I know my facility has actually pre-programmed in billing, I don't need to type anything into this section right here. And I'm going to say that this was actually a telehealth section. And just, I want to plant a tiny little seed. Best Notes has a new built-in telehealth feature that can be launched through the calendar that is very, very wonderful and easy to use. So if any of you are needing an alternative to Zoom or anything else for telehealth sessions, we have a new feature for you, and definitely reach out. We can give you a specific demo or training on that. But all of the clients I've worked with that are using it are extremely pleased with how it works. Okay, sorry, so back on track. So this is a telehealth session, and it was just the client and myself. And I'm going to hit append and close, and those selections are now going to embed it over here in the body of my actual note. And I'm going to just basically move from the top down. My next section is data. And then you'll see here that these buttons, the goal, problem, and objectives, those are coming specifically from the client's master treatment plan. So you as the provider can select these. You can also additionally, if it's applicable, you can free type into these areas. It's you can make these pre-programmed selections, or you can free type, or you can do both. So let's say that for this session, that the client and I were working on a major depressive disorder, but they also came in the door and told me that they had a fight with their roommate. And they really wanted to talk about that. And that's what we actually addressed in the session. And so even though we do always want to display that we are working toward the client's treatment plan goals, we also want our documentation to reflect what is really happening during our sessions. Okay. The next area that we have is the therapeutic interventions. And what we're looking for here is the actual therapeutic approaches that were used with the client in that session. So for example, I'm going to say we did DBT exercises, and that also I did another PHQ-9 like this, and we'll say that the client scored 17, and this would be the week one, and any other information that would be applicable. We're going to record the client's response here. We're going to speak to the client's readiness to change during that session. So not their overall readiness to change, how were they today? Okay. And you'll start to see, as you know, week to week, readiness to change can really fluctuate a lot for a client. But we'll say that this client was in maintenance. Functioning, and just to clarify up here, we're looking for the client's strengths and challenges that were in play during that actual encounter or session with the client. And so in this scenario, we're probably going to talk a little bit about the client's fight with their roommate a little bit. That would be the challenge that they're really expressing, but other things as far as just an example of a strength could be that your therapeutic alliance with the client is strengthening. or that you're really starting to develop a good rapport. I'm not the fastest typist, so that's going to represent everything I just said. And then at the very, very end, we're going to indicate the client's overall progress or progress at that moment in regards to their treatment plan. And so we're going to say the client is making some progress with the option to add any narrative here. Okay. And that information is going to come over. Oh, I'm sorry, my button mashing looks terrible. I'm going to get rid of it. Okay. Our next section is the abbreviated mental status exam. And you can see that you can actually flow through this quite nicely. It includes, again, a risk section. And what we're looking at is at a minimum that there's no suicide, homicide, or self-harm. There is an optional area to record any high-risk behaviors that the client might be reporting to you. So just for example, if the client told you that over the weekend they started shoplifting, that definitely represents a risky behavior that you would want to record. And the progress notes include the client's level of care status. And as I mentioned earlier, you just pop back over to a client page for you briefly. I hope that didn't make everybody dizzy. Okay. That if you utilize the episode information, we program that to auto-populate here. And so that's the information that you're seeing. But this is the part that your providers will address. At this time, the client meets the criteria for continued stay for the following reason. And right here, the rationale can be touched on very lightly. A good example would be that there are no emerging issues. And that's one more, and we finish up with plan. And here, usually it would be something simple like continue as indicated on the master treatment plan. But then also it includes a place for you to record your next scheduled meeting for the client. Okay.
Excellent. Christina, I'm sorry to interrupt. We are just about out of time. Okay. I'm sorry we weren't able to get to questions today, but I am going to send a short survey in the Zoom chat. So if you could take a few seconds to complete that survey, that'll help us channel any further questions you have or request to opt into a profile. We have about a minute left, so Christina, if you have any final thoughts.
I do, and I'm so sorry, everyone, that I have run over time. If you can stick it out with me for 5 more minutes, I can get to the end of this. So if you have the time, I please encourage you to just hang on for 1 more moment. So I'm going to save and lock this document. And here, and this is just a shortcut, I can do the same thing from my calendar, but now when I check this out to indicate that my documentation is done, it's going to do 2 things within your system. It's going to automatically record that billing information for the client, but also within our note in the profile, we have programmed the document itself at the bottom to populate with that billing information, which I'm sure many of you are aware that all of your billing companies really, really want that information to be in the actual note, and we have programmed that in the profiles. Okay, so moving on, just really quickly, there's only 2 other things left that come along with the profile. And you're going to find those within our group notes. We've built a standard drug UA group note, and this is designed to record the test results from an instant in-house litmus test or cup test. This is not something you would want to use if you are sending samples out to a lab. Okay. And I would just like to show you that this is our standard panel, and that the options are negative, positive, dilute, not tested. I'm going to indicate that the client tested positive here for amphetamines. And I'd like to just point out that there's a place to add in any substance that we did not include within the standard panel. I'm going to save and lock this note. But we built associated reports to go along with this. And I think that this will be really meaningful for most of you. And so here within your report section, we have this, the drug UA results report. You can run this report against all of your clients that have had these drug tests done within a certain time frame, or you also have the ability to filter it just by a specific client. And what that does for you is allows you to see how the client's test results have changed over time. And this is a report that is printable and also exportable. Okay. The very, very last thing that I have for you today is our group therapy note. And I'm just going to add one fake client today, but these group notes, of course, are built to handle multiple clients. Actually, I'll just add one more on here just to be safe. And then a quick highlight of the content of this note. If you'd open this up from the calendar appointment, your start time would have auto-populated and your name would have populated here in the provider field. If you open it manually, like I did just now, you might need to adjust your start time to reflect the actual time of service. You will type in your end time. We've programmed it with a drop down for duration, and we are asking you to include the number of participants in the group. Here, if you email us a list of the groups that your facility hosts and a brief, we're hoping 1 to 2 sentence intervention description for that group, we'll pre-program that as a drop down for you right here within this note, so that your providers would be able to select that. And then here they could specify, maybe a specific technique that they did within that group. Again, there's a place to record the next scheduled appointment. And then everything that happens below this line is what is unique and private to each client within that group. The highlight within this note is that it includes attendance. The options are present, absent, or late, and a place to be able to type in arrival time. It includes an abbreviated mental status. And I'd just like to point out that this can be multiple choice, and that we did include other in case you had a piece of vocabulary that we did not think to include within this list. And our hope is that will just make this a very flexible note for your providers. This note is auto-populating the client's diagnosis and their identified problems and objectives from their treatment plan. Why is that important or helpful to your providers? Because the areas that they actually need to chart on within the group note are these 3 areas: focused on, response, and plan. And this allows your providers to actually click in here, select this, paste it here, and then really focus on their narrative on the client's response and their plan section. And then here, I'm going to hit save and lock on this note. and then say that we also build an associated report with that document to go along with the group note. And just like the drug testing report, you can run this for all clients, group activities within a date range, or you can drill down on one specific client. And you can see that at a glance, you'll be able to see the client's attendance and also the key things that were recorded for the client in those notes. And that concludes the profile content.
Hey, thank you, Christina. And, you know, if folks have more time to stick around, we can stay and answer some questions. Just a few questions that have come in, Christina. One is, if we need to change things or add things to the profile due to a state requirement, is that possible?
Oh, yes. And that is a very, very important question. I'm so glad that somebody asked that. So with the profile team maintains and validates all of the content that is inside of the profile. And in order for us to do that, and also to deliver automatic updates to your database when you're opted into a profile, that content has to be locked in your system. So if you were to opt into the profile, all of the profile content that you would see would be uneditable to you and your facility. That means you cannot remove it and you cannot change it. What we are able to do, however, is add custom content to it. And so I think a really great example, or a common example that I've encountered, is up here in the CDA. I'm just going to fast travel, so I hope I'm not going to lose anyone here. But let's say in this recovery living environment, very often a facility will give me, maybe an additional 6 questions to add under family history, more detailed. And what we would do is we would add that custom content in after the family history label, but before this box. And that's essentially how it works within the Med Clinical. So we can add custom content into the Med Clinical of your database to your specifications, but you cannot edit or remove any of the content that came from the profile. If you're needing something customized in the template, what we'll do is build a custom version of the template for you that you have complete control over. But if you liked some of the auto notes that I used within the profile, you would be able to utilize those in your own custom note as well.
Thank you, Christina. And just to piggyback on that, just to be clear, am I able to implement just the CDA without the pre-screen, or vice versa? In other words, do I need to implement the entire profile, or can I pick and choose?
Well, if you as a facility or as the clinical director only liked the content of the CDA, what I would recommend is that you do not opt into the profile and that you work with one of our support specialists, and they would actually build you they could rebuild the profile CDA into your document as is, and have it match what I have in the profile. But the profile, all of these data points have been programmed to flow through your continuum of care. And so it would not work well within your database. You wouldn't have any of that. It would not play nice with non-profile assessments.
Excellent. Excellent. One last question. Could you talk about the template that's titled ASAM LOC? And would this template be appropriate to move a client from one level of care to the next? Or would you recommend another document in the profile for that process?
So the ASAM LOC document And I actually have it inactivated. So anyone on the line who's already familiar with this document, this is a sneak peek. This is something we're going to release. I believe we're scheduled to do this next week in an update for people that are opted into the profile. And that's why I had it inactive in here. So let me activate it and then show you some of the really cool things we just did to that document. So first and foremost, to answer your question, John, this document is a digital version of the ASAM level of care crosswalks that are found within the 2013 ASAM edition. And we just revamped this document, and we have, oh, I'm sorry, this is my old version. Can you bear with me for one moment? Sorry, actually, in the spirit of time, I think I'll just speak to the document now. Essentially, what it is it's showing the information that is available within those crosswalks. This particular document, as you see it now, was built for adults. Our new version of this note that we're releasing next week, we've actually, we have 2 buttons on here now. We've included the crosswalk for adolescents. So that was the big reveal. But here you would indicate basically what the client's situation is per and once you made those selections, and then here's for the OMT. And I'm just going to actually hit cancel and say that the client doesn't have any indication for that. Now, once I've made those selections, and I am going to take this template full screen just to show this information. I think this will make it a little more visually digestible. You'll be able to very quickly see the bullet points of what I selected. And so right here for level 1 outpatient, they need to meet all dimensions of this label. But if I had done this in real life with the client only indicated at dimension 3. So level 1 outpatient is not their recommended level of care. And that's essentially how this document was designed to function. Okay, and as you can see here, the bullet points that I have don't meet partial hospitalization either. And I wasn't terribly thoughtful when I was clicking those buttons, John, so I probably don't actually have any recommended level of care according to the guidelines. But hopefully this demonstrates how the note is intended to work. The next section, so the provider would click on this, indicate, the matches for the client's actual situation. And then once they've hit append and close, they'll review that information here. And then they're going to click the level of care status button. And it's going to show this information if that's already been recorded. If not, what you'll have is this label, current level of care. And if we're talking about admission, you probably wouldn't have that. It would look like that. And you would say admission, and then for the following reasons, you've already selected everything here, but you would probably talk about whatever level of care and just an additional kind of provider perspective on why you think that that is appropriate for them. And that is that document. So all the companies that are already opted into the profile are going to see next week an updated version of that automatically deployed to their databases. And we're really excited about it. I do apologize that I did not have the new version to show you today, because it is a vast improvement even over what I just showed you, and includes the adolescent crosswalk.
Excellent. Excellent. Well, that looks like all the time we have today. Thank you, Christina. Thank you to all the Best Notes customers out there who took the time to review the profile. If you got a chance, please complete that survey in the chat. If you have any additional questions or comments, please email team, like basketball team, at bestnotes.com, or you can reach us at 866-543-6646. Thanks again for your time. Have a great afternoon.